I'm Dorothy Lane. I arrived at Stony Brook in 1971, or as they say biblically, in the beginning. I'm currently the Associate Dean for Continuing Medical Education, the Vice Chair of the Department of Family, Population, and Preventive Medicine, and the founding director of the residency program in General Preventive Medicine and Public Health. And we've trained 138 residents in this shortage specialty as of now. Well, as a young person, it was really exciting to come to a new medical school, to get in on the ground floor, and to feel free to create new things in contrast to if you were chipping away at a calcified old medical school. So that was one reason. The other was family reason. My husband, Dr. Bernard Lane, was recruited by Dr. Marvin Kushner, who was then the founding chair of the Department of Pathology, who later went on to become the dean of the medical school. And Dr. Kushner had been Bernie's program director in pathology at NYU. So those were the reasons that I came, and it was a very exciting time. I think what was distinctive about Stony Brook Medical School from the start had to do with the vision of the founding vice president for health sciences and dean of the medical school, Dr. Edmund Pellegrino. Dr. Pellegrino was a nationally renowned bioethicist and humanitarian. And before he came to Stony Brook, he had been very involved in the development of a medical school in rural Kansas, where he focused very much on community-based training and involvement of the community. So it's no surprise when the initial faculty came, they all said, "Where's the hospital?" Because that delayed the development of the hospital. And it's because he wanted community involvement. And so he favored establishing relationships with community hospitals in the area. And Northport VA Hospital became one of the main training sites at that time for the medical students. Dr. Pellegrino was also very egalitarian, anti-elitism, and against the traditional medical hierarchy. So it's no surprise that there never was a doctor's dining room at Stony Brook. And his interprofessional influence today, there was a resurgence of this, of the importance of interprofessional training and team training. But in those days, Wednesday afternoons was devoted to all the Health Science Center students being taught together. And this egalitarian attitude spread also to the doctor-patient relationship, which was to be more equal, less paternalism practice. And that spilled over some too to the casual way the medical students dressed, and they didn't wear white coats. But the white coat part didn't last very long, because as soon as they went to and interacted with patients at the local community hospitals, the patients were sort of taken aback. They didn't want to be examined by these youngsters in casual clothes. So much to their surprise, the white coat gave the patients a feeling of security. He also was very interested and felt it was important to have interdisciplinary care. And that's one reason why he focused initially on building the multi-professional health sciences center tower here at Stony Brook, rather on building a hospital immediately. So his community focus also related to his early recruitment of chairs for the departments of community medicine, psychiatry, and family medicine, which usually don't get a strong foothold in medical schools from the start. So in community medicine, the founding chair was Dr. Jack Geiger, who was nationally known for his important role in the development of community health centers in the United States. He's particularly well known for the community health center that he established in Mount Bayou, Mississippi, where he included having a cooperative farm there, and he also would prescribe food for patients and charge it to the pharmacy budget, which sort of surprised the governor and other funding agencies. But he said that the medical textbooks clearly say that the specific therapy for malnutrition is food. So he justified it. Another early chair was Dr. Staniolis, who came to us directly from the National Institute of Mental Health, which he directed. And he was instrumental in recommending the development of community mental health centers instead of institutionalizing, or what they call warehousing, the mentally ill in big facilities that were far from the city. Just like out here, where at that time we had Central Islip and Pilgrim State Hospital were filled with patients. So after he arrived, he was here to experience the discharge of all those patients from the mental facilities. And he also recruited a chair for family medicine, Dr. Campbell Lamont, who came from Canada, where family medicine was more widely practiced. So relating to Dr. Pellegrino's emphasis on interprofessional training, he also very early on established a division within the Department of Community Medicine, which incidentally was the predecessor to preventive medicine, that focused on medical ethics and humanism. And it had an interdisciplinary faculty made up of sociologists, philosophers, lawyers, clergy, and from the beginning they were teaching medical students in a required course called Medicine in Contemporary Society, and that course still exists to this day. But by now we have a whole center for medical humanism, compassionate care, and medical ethics. And interestingly enough, now they offer a master's degree, and several of medical students have gone to get their master's degree as a joint degree. When I went to medical school, the women were only 10% of the class. And by now it's 50% of the class. And Stony Brook was one of the earliest schools to have a higher proportion of women. It was fascinating being an early faculty member to see how the women in the class called out the professors who referred to them as girls or dearie, sweetie, things like that. And it was both startling and wonderful to see the tremendous impact that had and pretty immediate change in attitude. So that's my recollection. Humanitarianism has stuck with us, and it's a very caring institution where people care about the medical students and each other, and that's really important. And it's also a very collaborative place, working with people with different backgrounds, and which makes for very fruitful research and teaching.